The variant, it's not unexpected the variant emerged. We know that the variants happen with this coronavirus between alpha, beta, delta, and a number of others that didn't really spread much. So this was sort of expected. What was unexpected was the number of mutations this particular variant had. And I suppose knowing where it likely came from, an immunosuppressed patient, perhaps that number of mutations now knowing that is less unexpected, but still, we don't usually see these many mutations all at one time. So a mutation really is just a change in the coding sequence of the virus, and these changes occur naturally. The viruses, as part of their biology, change their coding sequence, and that coding sequence during the change allows it to adapt to the environment. So the environment is within us as the host. The immune system sometimes has challenges, sometimes changes are good, sometimes changes are bad, but ultimately a mutation is just a change in the coding sequence and allows that virus to change over time. And like I said, sometimes it's good for the virus, sometimes it's bad for the virus, and then opposite, if it's good for the virus, sometimes it's bad for us, and vice versa. Mutations can occur in every virus. Some viruses have less mutations per replication cycle. Other viruses have more mutations per replication cycle. The coronavirus is sort of in the middle of that, and it's certainly known that this particular coronavirus can change dramatically over time, and it's not quite as high a mutation rate as something like HIV, which is certainly known as one of the higher ends, and yet some of the other viruses that are very stable with us are really at the lower end. This is sort of somewhere in the middle. As part of this normal process by which this virus replicates, you get these changes, and so we will expect more changes, and pretty much of all the, where we had 8,000 or 9,000 sequences now, every single virus that we sequenced is almost different from every other virus. And so it's just part of the process. And the fact that this is a large virus of nearly 30,000 individual coding points or base pairs means that any of those sites can, in theory, be changed. That's not how it happens absolutely in practice, but in theory, a larger virus could have more potential chances for changes. It's usually recommended if you have a reason to be tested, but certainly if you feel you're exposed at a high risk, you're with somebody who has recently tested positive and you have a high risk, whether it be through underlying conditions, age, pregnancy is another risk factor, asthma, diabetes are a number of other ones that have been mentioned in the past. And if you're worried, you can certainly go get tested, and that would be the best way to put you at ease if you think you are concerned. What you'd want to do is at least wait a few days, 3 or 4 days post potential exposure, or alternatively, if you feel symptoms, you would certainly want to go get tested at that point. Testing is the best way to do sort of a public health surveillance. Obviously, a test helps that particular person know whether they've had the virus, but as a public health entity, we can take that knowledge, figure out what the virus is, and then check or chart spread amongst a group of population, whether it be a nursing home, the population, a school, a prison, or any other type of setting. And so the testing becomes that first point of entry where you can get a sample to look to see what someone has. So you can absolutely get it infected again. So these coronaviruses are known that you can get it again, get it again, get it again. Certainly you do generate immunity from a natural infection, and you generate a similar immunity as if you were vaccinated. So a natural infection or vaccination provides natural immunity. But like all viruses, you can get things again. Just the vaccine or a prior infection mitigates potentially the serious side effects, so hospitalizations, death, or any of the other sort of serious things we see. Vaccine and the virus both generate natural immunity. The vaccine has the exact same spike sequence as is found in the virus. So you get the exact same natural immunity, whether it's a natural infection or the vaccine. The difference is, and the way I like to look at it, if you think of a vaccine, it's the RNA coding sequence of the spike protein, a little ball of fat, versus the virus, which is enveloped, and its genome is a positive strand RNA. So it is an mRNA, essentially genome, in, again, a ball of fat. You have sort of vaccine being a good infection, and I know it's not really an infection, but an injection, a good infection, where the virus is a bad infection. In the context, it brings other things, some of which damage your immune response, or at least mitigate or block your immune response. And what we see is every aspect of sort of pathology always is worse with the virus. You get myocarditis with the virus at a much higher rate than is anything seen with the vaccine. There are issues with fertility, obviously hospitalization, death with the virus. You don't see any of that really with the vaccine. So in all cases, the immunity is essentially the same. It just, you don't have all the negative consequences of the virus by getting the vaccine. Vaccination is still warranted, is still needed. There's no evidence yet that this Omicron variant completely evades the immune response. The way I like to look at it, if you have your hand on a ball, you have 10 fingers grabbing a ball, and all 10 fingers, if you're thinking of antibodies, would be different antibodies stuck to that ball being the virus. Even if you remove a couple, you're still holding that ball. And so even if there's a potential, and we don't know yet, that this Omicron variant might evade some aspects, again, it's not all 10 in this analogy. And one would guess, since we started with mutation, you need many, many, many more mutations to allow anything to completely evade the immune response. And we don't really have to worry about this being a doomsday virus in the context of completely evading. These take time, and it takes, a lot longer than what we've seen in a few years. And if you think of the flu sort of vaccine, each year you get a new vaccine because the flu in itself sort of changes, but it takes years and years to completely, in most cases, to completely get a virus to completely evade the immune response. So absolutely the vaccine is warranted, it's needed, and remains a very, very effective way to mitigate, block, and end this pandemic we're in.